Echocardiography is ultrasound imaging of the heart, usually done from four important transthoracic windows. Windows means usually the areas of the chest wall in which heart or major vascular structures do not have lung in between the surface and the structure. The four important windows are parasternal, apical, subcostal and suprasternal. This is the parasternal long axis view, often called as plaques view in short. From the chest wall, the beam is sweeping downwards and you see the anterior chest wall followed by free wall of the right ventricle and a portion of the right ventricle known as mostly right ventricular outflow tract region, interventricular septum, left ventricular cavity, posterior wall of the left ventricle, left atrium, aorta. And the pericardium, though it appears very dense here, is not so thick in normal persons. This is because it's an interface between different tissues that it is casting dense echoes. Actual thickness of pericardium is never so much in normal persons. This is from a normal person and not from calcific constrictive pericarditis. Previous view was just two-dimensional echo like this. Here you have side-by-side images. This is two-dimensional echo and you have color Doppler imaging here. That is, target in this case is not the heart muscle or walls. The moving red blood cells are the Doppler targets and you can see color coding. And here you can see that the aortic valve is open. One leaflet is seen almost near the anterior wall of the aorta. And mitral valve is almost closed position. Here aortic valve is wide open. Left atrium is mildly dilated. This is descending aorta in cross section. This is ascending aorta. And here you can see that there is a regurgitant jet which is labeled as MR. So this is color Doppler echo showing mitral regurgitation from the parasternal long axis view. You have to compare the size of the jet area to the left atrial area to get an assessment of severity of mitral regurgitation. You can also look how long it is extending into the left atrium. Here it's an eccentric jet. We move on to the parasternal short axis view. The probe will be rotated in such a way that the base apex axis is cut perpendicularly. And there are three sections possible. This is aortic section. Beyond that you can have mitral valve section and still distally you can have the left ventricular section at the level of papillary muscles. And it's very evident here, heavily calcified aortic valve, calcific aortic stenosis, aortic valve in closed position. And a portion of the pulmonary valve is seen here, right ventricular outflow tract, left atrium. An important structure, something like a boat I would say, is the left atrial appendage. This is one place where we look for thrombus. Left atrial appendage thrombus can be seen if present here. Here it is not there. Everything is quite translucent. So there is no left atrial appendage thrombus. If there is thrombus in the body, that will be seen in this region. In mitral stenosis, we will specifically look this region. In atrial fibrillation also, we will look specifically that region. And in atrial fibrillation, to look for thrombus, better will be transesophageal echo rather than transthoracic echo. That's because this is just near the esophagus. So it will be seen much better in transesophageal echo. Another image from the same person with aortic stenosis. The leaflets are now separated and you can see a opening here. That is aortic valve opening in systole. The leaflet is highly calcified and thickened. This leaflet is also thickened but not as much as this. Usually In normal person, in systole, when the valve is open, it will be flush with the aortic wall, and you may not see at all in a still image. A bit more distal view in short axis, parasternal short axis, at the mitral valve level. You can see that the mitral valve area has been planimetered, and the area is shown as 1.4 square centimeter. Normal mitral valve has an area of about 5 square centimeter, and this is thickened and narrowed mitral orifice in mitral stenosis. This is the cross section of the left ventricle, and this is the portion of right ventricle, circle and a semilunar structure. In that view, it is like that. From the parasternal echo window, we move on to the apical echo window. The transducer is placed over the cardiac apex, and beam is directed upwards. And most of us adult echocardiographers use this image. That is, this can be called as a inverted image, because this is the lower portion, left ventricle, apex of left ventricle, and this is the upper portion, atria. Here you can see the mitral valve in open position. Mitral valve is in open position. Here mitral valve is in closed position. This is the easiest way for a lay person to understand. This is right ventricle, right atrium, left atrium, interventricular septum, interatrial septum. You can see that there appears to be a dropout here, which is not a true dropout, because in 2D imaging, structures parallel to the beam may not be fully picked up. That's why there appears to be a false echo dropout. It is not seen here. And these are the openings of the pulmonary veins into the left atrium. Here there are no openings because it is right atrium. This is color Doppler echocardiogram from the apical 4-chamber view. Tricuspid valve is seen as closed, mitral valve also is closed, and left ventricle, right atrium, left atrium. You can see a jet, mosaic jet, bluish colored mosaic jet. Mosaic means multicolored. Mosaic is turbulence due to the high velocity. When the left ventricle contracts, when there is mitral regurgitation, there is a high velocity jet. It's reaching up to the pulmonary veins, very prominent jet. This is mitral regurgitation jet. Here you have a flow acceleration beyond the mitral valve. This is a slightly tilted view known as apical 5-chamber view. In the 5th chamber, you take the 5th chamber as aorta. So aortic valve will be seen here. This is left ventricular outflow tract. And this is the color bar, which will show the maximum velocity which can be imaged without aliasing in this system. That is 61 centimeter per second. Moving on to subcostal view. This is the best view to image the interatrial septum. You can see that very clean interatrial septum is seen without any echo dropout. The central thin portion is the fossa ovalis region, where you get the atrial septal defect in second AST. There could be a valvular opening in normal persons, even up to 20%. This is left ventricle, right atrium and left atrium. This is with the color sector. There is no flow across the interatrial septum. Subcostal view from another person with an atrial septal defect. The edges of the atrial septal defect has been marked, and we can measure the diameter of the atrial septal defect from this view. If it was for device closure, this has a good rim on both sides. Second AST with good rims on both sides, suitable for the device to hold there. Unfortunately, the window for device closure is probably over. Look at the color Doppler. The flow is right to left, from above downwards. Blue is away from the transducer. So this is blue flow away from the transducer showing right to left shunt. So this is ASD Eisenmenger syndrome, not suitable for device closure. Finally, we come to the suprasternal view taken from the suprasternal notch, and this is ascending aorta, aortic arch, descending aorta, and pulmonary artery cross section in between. Arch vessels are seen here. This is the left subclavian artery. This region is the narrowest portion known as aortic isthmus, and this is the place where we look for coarctation of aorta. And if there is a PDA, you can have flow from the descending aorta into the pulmonary artery also.